So why, after 340 years since we discovered this, do people still not understand that plaque isn't a thing, isn't a substance? It is a seething mass of plaque bacteria. Hi, I'm Dr. Ellie, and in this video, I'm going to talk about why the strategy I recommend is so effective to eliminate plaque. So why does my complete mouth care system work so well? It's a question I'm asked all the time. People always want to suggest what they've been using. The one thing I've noticed over 50 years now is that my system works for everybody. Everybody over the age of 6 can use it, and they will see benefits. And you can say, well, I've brushed and flossed and gone to the dentist for cleanings every 6 months, and my teeth are great, never had a problem. And that's wonderful. And I'm not here to try to take everybody who's got a system that's working and change them. I'm here for people who have something going on in their mouth that they want to control. If you have plaque deposits, if you've got cavities, if you have gum disease or bad breath, you need to use a different strategy. And what I want to explain in this video is, why does my strategy work when other things don't? And we can begin by looking at the advice most dentists give to their patients when they have plaque, for example. Brush more, floss more, come more often for deeper and deeper cleanings. So what is this all about? Well, it's about mechanically removing, physically removing the deposits of plaque from your teeth. And that's not adequate, in my opinion. Just as people say, oh, Ellie says don't floss. Well, I say don't floss because there is a better way, which is to eliminate the plaque that you are currently flossing away from your teeth. To have no plaque is surely better than having plaque that keeps reforming. And why does it reform? Why do we think that there is no way to control plaque? And it really goes back a long, long way. I am sort of shocked when I start looking at the history, because in the 1600s in Holland, a Dutch researcher who was very interested in making lenses, and his name was Antony van Leeuwenhoek, I think I pronounced it correctly, he decided to look at this substance that was on his teeth. He scraped a little bit of this white matter off his teeth and looked at it under this lens that he had made. And he was shocked to see that that material was crawling with little microbes in actual fact, but he called them animalcules, which are sort of little animals. He could see through the lens that this material was alive. It wasn't a substance. And he was shocked. How I discovered, I guess, was I saw on a television screen, a professor that I liked was showing us what plaque looked like underneath magnification. And we saw all these bacteria, and they were interrelated, and they were all in these little bubbles moving around, and the byproducts of some were feeding the others. They are all in a community. And when you have a community of good bacteria, that's wonderful, because they all like their best buddies to be alongside, and they, as I say, the byproducts of some kinds feed the other ones. It all works in harmony. Conversely, if you have plaque bacteria or harmful bacteria in your mouth, they are going to feed on sugars that you might be eating and drinking. They love acidic environments. If you're drinking diet soda, even though there's no sugar, the acidity is going to promote a problem. And one of the things, again, that I think it's taken decades longer than it should to understand, that many people have acidic saliva. The liquid, their whole mouth environment, is going to be encouraging plaque bacteria to grow. These are the people who cannot help big deposits of plaque forming. Often it's women who are pregnant, or women during their cycles or during menopause. Terrible things happen to their teeth, because plaque gets out of control when your mouth is acidic or dry. My system works differently by actually addressing the bacteria, the live bacteria, before they attach themselves to teeth. When you use my Complete Mouth Care system, it actually uses an essential oil mouth rinse. I know most people think Listerine is some mouth rinse that's full of toxic chemicals, and I don't like the colors, and I agree with that, but it's so useful because the essential oils in Listerine specifically target immature plaque bacteria. By targeting these little seeds of plaque, you can actually help to stop them growing on your teeth. The big problem is, in the days when people used to just use Listerine on its own, and you may have heard that Listerine, it dries your mouth and it's damaging. Yes, it can dry your mouth if you don't rinse it off your teeth. Yes, it is acidic and can actually promote the growth of plaque if you don't wash it off your teeth. What unfortunately happens for some people is they get looking too tightly, too small. They are looking at things without seeing the bigger picture. And the real beauty of the Complete Mouth Care system is that each of the products helps and works with and interconnects with the one you used before. And it targets not only the plaque bacteria floating around, these are called planktonic bacteria, the ones floating in saliva, but it also targets the ones that are hidden down beside your teeth in pockets. If you have gum pocketing or periodontal disease, the first mouth rinse, if you give it a full minute, will travel down these pockets and create oxygen. My goal with the whole mouth care system is to actually promote healthy bacteria in your mouth. As I said, when healthy bacteria start to form a biofilm on your teeth, healthy bacteria attract more healthy bacteria, and they all get together and form these communities that actually defend our teeth from cavities, from gum disease, from abrasion, from damage, from everything. So how did I come about this? How did I discover the Complete Mouth Care system? I won't go through all the details, but in a nutshell, I had had terrible acne as a child at school. And at the boarding school where I went, we were given horsehair scrubbing brushes and some ivory soap and told that our skin was dirty and we needed to scrub it better. And I didn't want acne, so I scrubbed really hard. I did a lot of scrubbing. The outcome of that, as anybody who knows anything about skin, is that my skin was dry, it cracked, I would have areas where it was bleeding, and it didn't help the acne for a second. And that went on year after year, and I felt a complete failure, and I felt that my skin was dirty, and I didn't like it, and I didn't know what else to do. And that is kind of the situation of people who are struggling with dental disease. They do the brushing and flossing, they do what they're told, they're trying, and it's just not working. When eventually I bumped into a lady from the Clinique cosmetic industry in London, Selfridges, as a teenager, she called me over to assess my skin. And this sweet lady told me, oh my goodness, you have really delicate skin. You need these 3 liquids. And you put them on, this, followed by the moisturizer, a cleanser, a toner, and a moisturizer in these 3 consecutive ways of doing it, one after the other. You will see improvement because it actually balances the pH and the bacteria of the skin. And for me, she gave me obviously exactly the right products because within a week or 2, my skin had turned around from being this absolute nightmare to being skin that when I was in my 20s, people would actually sometimes ask me, what do you use? Because your skin's so beautiful. And it was so different in such a short time, and it was stunning for me. I was just being given the wrong advice. Advice that maybe would have worked for maybe somebody with good skin pH, or maybe somebody who didn't have my problems. But this is what interested me in the idea of 3 mouthwashes. Long story short, I began in my office. I began first with my mom, and anyone who knows the story of my mother about to lose her teeth and how she kept them until she was 95 years old. Then in my practice, I would teach patients, I would teach entire families how to use this system and see the effects on everybody in the family. It was an incredibly busy practice. I used to work 6 days a week and even sometimes have patients on a Sunday because I couldn't fit everybody in the door. People were clamoring to learn how to use this system that stopped dental disease. It allowed them to get a grip on what was going on and prevent it moving forward. And I saw this over and over and over again. I wanted to share it more widely, but it's a difficult system to explain to people because you need a minute with this, and if this is too spicy, you don't use it for so long, and then you want to use these special toothbrushes, and you need to massage your gums. Most people have never heard of massaging their gums. So all of these little facets and features. And then there's the xylitol. Xylitol is the miracle for promoting good bacteria and making the plaque that is mature and already stuck on your teeth disappear. So that's an important component too. And so this is just an incredibly awkward thing to start telling people about. Well, at least it was before the internet. What I actually decided to do was rent a ballroom in a hotel. And in this ballroom, we had, I think it was about 150 people each time. And I would give seminars. And of course, now with the internet, this gives me another new opportunity to do some of these seminars for you, wherever you are. And we're realizing that we're actually reaching other countries. People in South Africa and India and New Zealand and Australia and Europe and everywhere interested in how do they get the products. And at this point, I don't have a really good solution for you because one of the issues is you cannot ship liquids between countries at the moment. So if you're in another country, what I would suggest, you might be able to get, if you can't go to the local grocery store and find xylitol products, for example, maybe you could get a forwarding mailing address. There are businesses that will give you a forwarding address. And when you send products that you order online to this forwarding address, they will ship it on to you. Wherever you live in the world, in the Philippines, in Saudi Arabia, you can certainly access xylitol products, granular, the gum, the mints. You could access the toothpaste that I recommend. And although you can't get the mouthwashes, you can probably find, by going to a dentist in your country, where you would be able to get the 0.05 sodium fluoride mouthwash, something comparable in your country, because that's pretty common worldwide. So if you need the downloadable booklet, you can go to my website. We have a free downloadable booklet. And even if you can't get all the products, you can at least get some of them and start there. And we will try to create a booklet for other countries or keep in touch with you how you can do this. Let us know that you're in another country and we'll see what we can do to send you. We're going to try and make a little PDF of how you might go about this. And then the other thing, of course, is to learn more. I have a book called Mouth Care Comes Clean, which goes into the science of how we adjust the microbiome of the mouth. Read the testimonials, download the booklet, and if you want to really learn more, I have an oral health video boot camp that many, many people have found useful. It is a community of people who are so engaged and so excited about learning all about this system and how it works and why it works. And I think that this is a very exciting group to be a part of. So that's another opportunity for somebody perhaps in another country to learn more. And then you can, gradually learn how you can implement something like this where you live.